Hi, Dr. Steve Z, one of the emergency medicine physicians at Enloe Medical Center, coming to you again. I think our 6th time together now. Hope you've been doing well. So I thought I would go down a little bit of a comparison about what you can expect and maybe want to understand about the flu and how that is or isn't different than COVID-19. So we're going to do a little bit of a comparison. Flu on one hand, COVID on the other. How common are these things in our community right now? Let's talk about the flu. We're just starting to see it in this area. I was in a meeting last night. We're just starting to have a few cases. COVID, there's a lot of it in the area. There's a lot of it in the whole state of California. I'm sure you're aware, over 99% of the population in California is in a Tier 1 or purple zone. It is everywhere. Symptoms. Well, I really wish I could tell you that flu symptoms and COVID symptoms didn't have an overlap, but unfortunately, they really do. So let's talk about the things that can be common. Fever, chills, cough, headache, sore throat, stuffy nose, vomiting, diarrhea. All those things can be either flu or COVID. Fatigue, another one. But there is one really significant difference. With COVID, if you lose your sense of taste or smell, that's COVID. Do not expect influenza to do that to you. So the big difference here is not how lousy do you feel and do you have any one of 10 or 11 symptoms, but the big difference is COVID, sense of taste and smell. If you lose those, that's very specific for that illness. Let's talk about if you get an exposure, how long it might be before you get sick. Incubation period, that's what we call that. Incubation period for the flu, 1 to 4 days. Incubation period for COVID, you've all heard it before, 2 to 14 days. About half of people who get COVID 5 days after their exposure, they will start to show symptoms. That's true overwhelmingly for almost 100% probably of influenza or flu. So, big difference in that incubation period. Once you've got this virus, how long would it be that you're contagious to other people? Great question. Influenza, probably a day or two before you start having symptoms, to maybe 3 to 4 days after the onset of symptoms. COVID, part of its challenges is a bigger window. It's definitely about 2 days before you start having symptoms, and it can go to 5 or 7 days of peak infectivity after you start having symptoms, and possibly even a little bit longer. There's other stuff that happens in the holiday season. We all know it, the winter colds. I've got sniffles. I feel a little bit of a sore throat or a mild headache, but don't expect those kind of colds to make you feel like a truck just ran over you and you can't get out of bed, that you are having a hard time breathing, that your joints and bones feel like they're aching more than you've ever experienced before in your life. That's not what the common cold's going to do. But unfortunately, of course, influenza, the flu, and COVID both can do those type of things. One of those other big differences, while both the flu and COVID can give you the ability to pass on this disease when you haven't yet gotten symptoms, we've all been hearing it. A lot of people never get symptoms with COVID, and yet they're still infectious and they can get other people sick. So that's why we've really got to remember that even if you feel fine, we need everybody to take these precautions to keep everybody safe. Okay, so that's a little bit of a breakdown along a lot of points of influenza or the flu and COVID. Thanks a lot for your help. Stay safe.